Waking up with a newborn is hard. Knowing more about how babies sleep and what to expect during those first few months will help you feel more relaxed and confident.
Why won't my baby sleep through the night?
You know, that's really tough, and I know that especially the first few weeks, and I know some of you even have younger babies than Aubrey, that it's really hard to have to wake up so much. But actually, babies have a reason why they have to wake up. They have very small stomachs when they're born. They're born very small. And in fact, can you imagine how big a baby you'd have to give birth to if you really had a baby that could sleep for a long period of time without being fed? I don't think any of us want to do that. So babies have to wake up frequently at night to stay healthy. They have to be able to be fed. They have to be able to be changed. Sometimes they need extra care at the night, and that's why they don't sleep at the night.
When will she sleep through the night?
You know, that's the most common question we get. Everybody wants to know, when is the baby going to sleep through the night? Well, babies actually sleep very differently from adults. The way it works out is that you and I, we sleep in light sleep and deep sleep sometimes, and so do the babies. But babies, especially the very young ones, when they first fall asleep as a newborn, they start dreaming. And dreaming is really important for babies because it's part of the way their brains develop. But the problem with that is while they're dreaming, they actually are easy to wake up. And it's good because we talked a minute ago about how they have to wake up to be fed. So it's important that babies wake up to be fed and are in a light state of sleep. As they get older, they have that dreaming period last a little bit less time, and so they fall into that deeper sleep for longer periods of time. And as they get bigger, they're also able to stretch out that sleep. So there really isn't one answer to your question when your baby will sleep through the night. But what happens is as babies change, they all change kind of the same way. First, they wake up very easily, and they sleep for really short periods of time. And then later on, they get bigger, they can go longer stretches, and they sleep more in that deep sleep, which makes it less likely that they wake up.
He's only 6 days old. How can I get a little more sleep?
Yeah, you're really in the thick of it. It's the toughest part when those first 6 weeks because the babies wake up so often and you can't really predict when they're going to be asleep and when they're going to be awake. So it's definitely tough. So the first idea we'd share with you is to get some help. Make sure you have somebody at home who can help you with the chores and other things while you get as much rest as you can. But you know, some research has recently come out to suggest 3 things that you can do to help get a little more sleep during those first 6 weeks. And it's not a lot of more sleep, just a little. First, have the baby very close by. So if the baby wakes up at night, you don't have very far to go to help your baby. Second is to keep the lights pretty low, like maybe keep just a night light on, unless there's a reason why you really need to have bright lights, like if you're going to give your baby medication or something, you don't want low lights. And third, to try a little white noise, because like static or something that just makes the same noise softly in your room, because what happens is that newborns tend to make a lot of noise while they're sleeping. They kind of move around and gurgle and things, yeah. And so if you have a low noise to help you rest a little bit until your baby makes a little bit more noise and really is waking up and needs you to wake up too.
It is easy to tell the difference between light sleep and deep sleep. During light sleep, babies dream. While he dreams, his eyes, face, and body may twitch or move, and he might even smile and make little noises. His eyes may open and close even though your baby is still sleeping. During light sleep, blood flow to the brain is increased and the brain is active. This is important for brain development. Dreaming babies are easy to wake up, but remember, the ability to wake up easily is important for your baby's health and safety. If your baby wakes up when you try to lay her down, you may want to watch for signs that she's fallen into deep sleep before you lay her down. During deep sleep, your baby will not move very much, and her arms and legs will be very relaxed. She'll be harder to wake up. Deep sleep is important for baby's growth and complete rest. Babies need to go through periods of both deep and light sleep. Adults do too. Newborns only sleep about 2 hours at a time. Fortunately, around 6 to 8 weeks of age, your baby's sleep will change. He will dream for shorter periods of time and sleep longer at night. By 3 or 4 months, your baby will fall into deep sleep first, dream a few minutes at a time, and will sleep for longer stretches. By 6 months, many babies are able to sleep up to a 6-hour stretch, but don't be surprised if your baby still sometimes wakes at night. Babies may wake up more often when they're sick, uncomfortable, or they have a change in routine. It is tough to wake up with your baby at night, but it's important that your baby is able to wake quickly if she really needs you. It does get easier. Your baby will sleep longer as she gets older. Without words, your baby will use her body and noises as cues to let you know when she wants to eat, learn, play, or rest. Watching for your baby's cues will help you know what your baby needs.
How can I tell what my baby really wants?
You know what's amazing about babies? From the moment they're born, they're able to communicate with you, and even just right in the hospital, they're able to give, signals with their bodies and the way they make noise and how they're breathing to you, because they can't use words, obviously. But like right now, he's trying to tell you that he wants something to be a little bit different, right? Whatever's going now, he doesn't really like it. And he tells you that by turning away or scrunching his face or looking tense or even getting a little fussy. And when he wants to play with you or he wants to learn from you, he's going to be much more relaxed and his eyes are going to be open and looking at you. And those are signals that that's what he wants. He wants you to play and socialize with him, which is very important for him. So what happens is when a baby is trying to tell you, I need something to be different, Mom, but then Mom isn't quite able to right away make the change or whatever the baby needs, then sometimes he'll start to get fussy. So knowing those cues, the ones where they really need something to be different, or that they really want to connect and socialize with you, knowing those cues can make crying a lot less because you'll be able to respond before they start to cry.
So I heard that there's a special cry when babies are hungry. Is that true?
I've heard that too. I think it's easier just to look at the baby, because when the baby is hungry and fussy, that means the baby probably had given hunger cues before the baby got fussy. I know those hunger cues when they bring their hands towards their mouth and they're rooting and they're opening and closing their mouths, and some of the tiny ones will actually start making sucking noises. And when you hear a baby that gets a little fussy and is doing all that, you think you have a hungry baby. Preferably, you look for those cues before the baby starts to cry. But there's a big difference between a baby who's crying or fussy and doing this, and a baby crying and fussy and doing this, and that baby probably isn't hungry. That stiff baby who's not trying to put their hands near their mouth may be overstimulated or upset by something in the environment.
Sometimes when he is already eating, he'll put his little fist in his mouth, which I thought was a signal that he was hungry. It's a little confusing.
He's so young that it's really hard for him to use his body on purpose. He can't move his hands or move his legs. They just sort of happen. They move reflexively. So what's happening is your baby's telling you, I'm hungry, Mom, by showing you those hunger cues, but it's just taking a little bit longer for, as he starts to feed, for him to feel relaxed enough to bring those hands away. So it's really common for a breastfeeding mom to kind of have to get used to taking the hand a little bit away from the breast when the baby first latches.
I heard that if you hold a baby too much, they'll get spoiled and get used to it. Is that true?
I think a lot of people think that, but actually when your baby is giving you cues, like right now, when your baby's giving you cues that they need you, either because they want to play with you or because they need something to be different, then it's really important to respond to them right away. And so rather than spoiling them, actually when you respond to cues, they get better and better and better at giving the same cue, and then you're going to be confident that you know what to do with that same cue. So when you respond to your baby, you actually develop your own little language together, and it makes it easier on both of you.
Yeah.
At first, it may be hard for you to understand your baby's cues. Newborns don't have very much control over their bodies, and their cues can be confusing. Fortunately, babies and parents quickly get better at understanding each other. At first, your baby will stare at your face and follow your voice for a short time. When he's older, he will watch your lips as you speak to him. When you smile, he will try to smile back. These cues mean that he wants to be near you. When you talk or play with him, he'll be working hard to learn as much as he can. Don't be surprised if all this learning makes him tired. When your baby is hungry, she will use lots of cues. She will bring her hands towards her mouth, move her head from side to side, open and close her mouth, and try to latch. When he's done, he'll turn away or use his hands to let you know he's had enough. When babies get tired, overstimulated, or uncomfortable, they will tell you they want something to be different by turning away, pushing away, or arching away. These cues can be confusing because the baby can't tell you what needs to be different. You'll need to look around and figure out what might be bothering your baby. Does she have a wet diaper? Is she sleepy? Are the lights too bright? Or are there any loud noises? Sometimes babies need time away from excited brothers and sisters or too many new faces. When you see the cues that your baby needs something to be different, you can keep your baby from getting fussy by responding quickly and fixing the problem. There's no need to worry if you don't always know what to do. Your baby will tell you when you get it right. With practice, you'll both get better at communicating with each other. Crying is one way your baby communicates with you. Understanding more about why babies cry and what you can do to help your baby will make things easier for both of you.
Why is it so stressful to hear a baby cry?
Actually, it's really important that it's stressful to hear a baby cry, though that's really hard to tell a parent. But if you think about it, if a baby really needed you and your baby went, ah, would you really care? You know, it's really important that the noise that your baby makes when they really need you is loud, because you may be very tired, and it doesn't sound very good, and it kind of stresses you out, and it makes you want to take action to help your baby. So even though listening to a crying baby is very stressful, it's actually very beneficial that your child has that talent to make that loud noise that's unpleasant, that helps you know when she really needs you.
Why do babies cry so much?
Well, you have to realize that they're new to the world, so everything is new, and that's the lights and the sounds and the smells, and also the stuff that's going on in their own bodies are new to them. So sometimes babies just don't like, what's going on around them, or maybe even what's going on inside them too. So that's why they tend to cry a lot. What happens is they do try to tell you, like she's right now trying to tell us that she's just not happy about something, and not another one now. And so she's trying to give that signal that she wants something to be different. And so we want to make sure that you respond to that. And the more you respond to those signals early, the less she'll cry.
Sometimes my baby cries and cries, and I know she's not hungry. What should I do?
Well, what happens, babies sometimes get overstimulated, or there's just too much input, or they're just slightly uncomfortable, and so they'll let you know by crying. And one way you can calm them down when you know they're not hungry, because of course if the baby's hungry you want to feed the baby, but if you know the baby's not hungry, you can do the same thing over and over again, and that usually calms babies down. The way that our minds work is when we have the same sort of boring thing happening over and over again, we calm down and get rested, and so the babies will do the same thing. So if you hold your baby close and just stroke your baby's back, or say the same words over and over again, like our instincts tell us to do, the baby will calm down. You just have to give it some time, because sometimes when babies are upset, it takes a while to calm them down. She's doing a great job doing it right now.
You can tell when your baby is crying because he's hungry, or when he is crying for other reasons. Hungry babies use many cues, like bringing their hands near their faces and trying to suck on things. Crying babies who are not hungry will hold their hands stiffly away from their faces. They may also turn, arch, or push away from you. Remember, your baby's not really pushing you away. These cues are the only way your baby knows how to tell you that she needs something to be different. Being a parent is stressful. If you ever start to feel angry or overwhelmed when your baby cries, put the baby down in a safe place for a short time and take a break. Taking some deep breaths, talking to another adult can really help. By taking a few minutes for yourself, you'll come back better able to figure out what you need to do for your baby. When babies get overtired or overstimulated, they often start to cry. Holding your baby close, rocking, and saying the same words over and over again can help your baby to calm down. Even if it takes a while for your baby to respond, keep doing the same thing over and over. You might think that changing your baby's position or showing your baby's toys might help, but if your baby is already overstimulated, he'll keep crying. Be patient. Sticking with the same action for several minutes before trying something different can be the secret to success. You may be wondering, how could I possibly have time for all of this? Fortunately, as your baby gets older, she will calm down much more quickly and she will cry less and less.